produced the same way as the seasonal vaccine. So those people who are eligible and targeted through the priority group should receive it to protect themselves. At least that's one of the major ways they can take action to protect themselves from the flu. As one who's had the flu years ago, it's not a fun thing to do. So if you can prevent it, by all means, you should get the vaccine.
In addition, in addition to protecting yourselves with public health, we're looking at protecting others, particularly those who can't get the vaccine, healthcare workers and parents taking care of young children. You want to protect the child, so that's the reason why you would get the vaccine.
Right.
But do speak with your provider in terms of those contraindications.
Right. Now, some of you sort of alluded earlier to some of the basic precautions people can take. Maybe we can wrap up with one review of those once more so people can not lose sight of them.
Absolutely. We do recommend that you do stay home when you're sick. And at this time, CDC recommends that you stay home at least for 24 hours without a fever, without taking medication to prevent that fever from coming. So you want to, they're not putting a number on how many days you would stay home, but you want to monitor your fever and your other symptoms. Try again sneezing and coughing into your arm, not just into your hand, or if you are to use a tissue, dispose of that. And make sure you wash your hands after that episode or whenever you feel it's appropriate to wash your hands before and after eating when you've touched other objects, as well as try to limit touching your hands to your mouth and your face. And avoid going out, when you're sick.
Great. And you alluded to it's not only protecting yourself, but these are all contributing to protecting the broader picture of the population.
Yeah,
so
and I would just add to that, the schools are very much working with us with regard to this stay home for 24 hours after the fever and being, no fever reducing medications. But it's also important in the workplace because, employers often insist that, employees come to work and there's this mindset that you have to go to work, but they're turning around as well. So it's not, it's certainly the schools, but any place people congregate, if you're sick, stay home 24 hours.
Great. Well, thank you both very much for sharing this important and timely information. We'll have all information available on our website, and thank you very much for watching Public Health Matters.
We've seen a lot in the news about swine flu or the H1N1 virus. Governor Corzine and I are implementing New Jersey's comprehensive plan to prevent the spread of H1N1 and seasonal flu. Protect yourself. Even after you've received your seasonal flu shot, go back for an H1N1 vaccination. Do your part to prevent the spread of flu. Wash your hands often, cover your coughs and sneezes, and stay home if you're sick. Go to nj.gov/health to find out where you can go to get vaccinated.
I order you to cease any and all supernatural activity and return forthwith to your origin or to the nearest convenient parallel dimension.
Try to imagine all life as you know it stopping instantaneously in every molecule.
Keep good health in the spotlight. Remember to cover your cough or sneeze with a tissue or your elbow and wash your hands frequently throughout the day. These simple actions help keep everyone healthy.